Today I'll be talking on effect of Nepafenac 0.1% on choroidal thickness in patients with acute central serous chorioretinopathy, a pilot study. As we all know, the CSCR is a pachychoroid, part of pachychoroid spectrum of disease characterized by the thicker choroid and the serous detachment of the neurosensory retina. And it is well proven that NSAIDs, by inhibiting the cyclooxygenase enzymes, hastens the resorption of the subretinal fluid, but its effect on choroidal thickness in acute CSCR cases was unknown. So we thought of measuring that effect, whether it affects or not. So when we did the literature research, then we found that people have studied its effect on choroidal thickness post-cataract surgery cases, where they found the rise in choroidal thickness in post-cataract surgery was lower in Nepafenac treated group as compared to non-Nepafenac treated group. And the other review article, they found that there is no significant effect on choroidal thickness of Nepafenac in normal patients. However, it has been observed that prostaglandin analogs are associated with rise in the choroidal thickness group. So our primary objective was to study its effect on choroidal thickness in acute CSCR cases, and secondary objective was to study its effect on base-corrected visual acuity and central macular thickness. So it was a prospective interventional study done in Sri Ganpati Netralaya, where the main inclusion criteria was the treatment naive acute idiopathic CSCR cases presenting within 3 months. And the exclusion criteria were the chronic CSCR cases, those who have received some treatment for it, and those who are sensitive to any component of the study medication or any known cause for CSCR. So after obtaining a written informed consents, subjects were recruited for this study and a thorough ocular examination was done. The central macular thickness and choroidal thickness was measured by performing the swept source OCT, that is top cone Triton. The choroidal thickness was measured subfoveally manually by measuring the distance between the outer border of the RP and the inner border of the sclera, and average or mean of the 3 readings was taken. Then the subjects or patients were started on Nepafenac 0.1% thrice daily, and the review was done at 1 month and the 3-month follow-up. Data was analyzed by using SPSS software. So when we compared the results, there was a sample of 50 patients where the males were the predominant and having the mean age of 37.6 years. When we compared the base-corrected visual acuity, it has been observed that there was a significant improvement statistically in base-corrected visual acuity for distance and near vision when we compared the data from first visit with the second with the third, and first with the third. Same is the case with the central macular thickness. Additionally, we also tried to see its correlation with the age, but there was no correlation between the age and the central macular thickness. That means the treatment yields effective improvement in central macular thickness in all age group. However, in subfoveal choroidal thickness measurement, there was a significant difference in the reduction of choroidal thickness on each follow-up and in between the 2 follow-ups. However, there was a negative correlation with respect to the age. That means the younger the patient, they have showed a more improvement in the choroidal thickness reduction than with the older age group. The 4 patients out of 50, they complained of burning and stinging reaction to the drug or medicine, which was later subsidized on its own, and no serious adverse events to the medication was seen. This was one of the images of one of the participant, where there was a significant reduction on subsequent visits in the subretinal fluid and the resorption of SRF and the subfoveal choroidal thickness. So it was the first of its kind observation where the Nepafenac proven a significant reduction in subfoveal choroidal thickness in CSCR, which is a part of the pachychoroid spectrum of diseases, having excellent safety profile. It was hypothesized that it was published earlier that PG analog are known to cause rise in the choroidal thickness, and it is being an anti-PG synthetase inhibitor, so it might reduce the choroidal thickness. So, but there are certain limitations like smaller sample size and long-term outcomes were not known, and there is no comparison group was there. And The chronic effects in complicated or chronic CSCR cases, we don't know yet. But there is still a lot of scope for the further research, like comparing the effectiveness of different NSAID molecules in CSCR cases. Also, in addition to choroidal thickness, we can consider measuring the choroidal vessel density or the choroidal vessel caliber measurement in future. Thank you. Thank you so much.
Dr. Desai, I just wanted to ask you, did you have a control group in this study?
No, actually, ma'am, the same question was raised in our ethics committee meeting, that there is no control group in this study. But then our statistician and pharmacologist, we sit together, and then we thought it's a pilot study and none of the study was published earlier. So if it is a first study, then you can go ahead without the control group as well. But study holds a stronger value if you add the control group. So
because here we are dealing with a disease which is known to have a spontaneous resolution.
Yeah.
And actually we have done a study at our center where we actually compared eplerenone, we compared rifampicin and antioxidants, and all the three, it was a randomized study, and we actually found the antioxidant group did the best.
Yes.
So and also we had a control group.
Yes.
So here, we know that it is going to have a spontaneous resolution. So whether it is actually because of Nepafenac or it is just a spontaneous, it's very difficult to really say.
Yes, that's true, ma'am. But that all studies were compared the subretinal fluid comparison. None of the study compared the choroidal thickness, and it is a part of pachychoroid spectrum of diseases. So we thought of comparing this on subsequent visits. But sure, we are in process of including comparative group also in future.
That's a nice idea, but only thing is that, it is known that probably once the disease is active and you have an inactive, when you have resolution of fluid, the choroidal thickness does change. So I don't know whether it's really Nepafenac working, because even with PHCR, we've already published this where the choroidal thickness is thickest as when the disease is active only at the area of the PHCR. So, and then once the PHCR resolves, the choroidal thickness also, the difference between the subfoveal and the PHCR thickness is different. I mean, reduces, the difference reduces. So probably it's just, the disease activity which is going down. So.
But it's very interesting. I hope you come up with some solution for our cases as well.
And we are planning to extrapolate these results to other pachychoroid spectrum diseases as well.
Maybe you can take the thickness of the other eye for the same patients at least.
Yeah, that
Thank
can
you.
also. Thank you. Thank you.